Hey everyone, how you doing? So in this video, let's look at some of the key design features about making a fantastic looking smile. And I'm going to show you a photo of a lady who came in a little while ago, and I don't think we've done the treatment. I kind of know who she is, but maybe she didn't actually go ahead with the treatment. But the principles which I'm going to share with you are the same, whether we do veneers, whether we do an all-on-4, whether we do braces and a little bit of edge bonding. We always want to adhere to these kind of guidelines, which I'm going to speak to you about, because from here, we know that it will look good for most people, and then we can add our own customizations to individualize that smile for that individual patient. Now, the regular viewers will notice that this is a completely different setup. I've just moved the furniture in my office. I've still got the blue sofa to watch TV and stuff, but you're in the corner with my desk, which I was forced to tidy up for this video, but you can see I've got embarrassing wallpaper which just stops halfway in the wall, so I guess that's a DIY project for this weekend. Now, let's look at this smile, okay, because in this photo you can't really see the overall extent of the issue. So we're going to look at this photo, then we're going to look at what we call a retracted photo with the cheeks out, so we can really gauge what we need to do, because 99% of the time when somebody comes to see me, they don't like the look of their smile. When we ask them to smile and we point a camera at their face, their smile is not natural. Okay, so please bear in mind that all the photos that I do share with you, the patients who have these photos, they know their smile isn't good, okay, and the reason that they're seeking help is because they're embarrassed of the way that it looks. So if we look at this lady here, we can see there's a whole bunch of things which aren't quite right. But before we focus in on all of those things, let's look at what a perfect smile should look like. So one of the things which we look at when we design a smile, and I'll just get the pen up on the screen to the right size, is the lower lip. So you can see the lower lip kind of line is kind of like that. And what we want to do is actually replicate that in the arch of the teeth, okay? And when I say arch, what I mean is a smile line of the teeth. So the teeth, if we have them a certain length, we want this line of the bottom edge of the teeth to be parallel with the lower lip. Okay, and that's one of the first starting points of designing a great smile. The next is the length, and the length is really important. So by length, I mean how high or how low should this smile line be. And this is different for every patient because it depends on sex, it depends on age. So ladies tend to show more teeth than men, so they'll have a lower smile line. And as we all get older, we show less and less teeth as we get older. Less and less top tooth, more and more bottom tooth. So we want to make it age appropriate, and when we're looking to rejuvenate a smile, typically we're going to add a little bit of length to some of the teeth. Now, let's have a look where we are. So we've got that line. The next kind of main thing to look at is the midline, which we don't care if the midline is off center. If we're doing an all-on-4 where we've got complete control, obviously we're going to make it central of the face. But typically, when we do veneers, we don't move that midline left or right. What we do is make sure that the midline is parallel to the long axis of the face. We do not want it canted left or right. I know a couple of people who watch these videos have come to see me in person, and they will recognize everything that I'm saying, because in almost every single consultation that I have, we go through all of these principles, so my patients can understand what a good smile looks like, and we can see what is creating disharmony in their own individual smile. Now that we've got the midline and the length of the teeth correct, the next thing is the width of each tooth. Okay, the visible width of each tooth, because as we look at our back teeth are bigger than our front teeth. Now, visibly, we can see much less back tooth than we can on a front tooth. So what we're looking at is just a photo like this, straight on. We want the front teeth to have a certain width, but in relation to that width, we want the next tooth to be a bit smaller. And there's a mathematical proportion, it's called the golden proportion, and you can Google this, you'll find it everywhere. And that proportion is roughly 1.6 to 1. So what I mean by this is the width of this front tooth, we want it to be 1.6, and in relation, the width of this next tooth will be 1. Then going back, we want this tooth to be 1.6 in relation to the next one, so we want that to be a value of 1. So I'm just going to draw this. Let's get all these figures off the screen because they can be a bit confusing. I've just drawn this in a little bit, and I'm going to try and get it as symmetrical as possible, but I'm kind of just guessing, you know, that's probably about right. And once we've got the edges of the teeth, we've got the length of the teeth, all that's left is the gum line on the teeth. So the gum line, let's say, is going to be about there. Each front tooth has a height-width ratio. Okay, so we want the width of the tooth to be about 75 to 80% the height of the tooth, and the height is typically around 11 millimeters. That's not set in stone, it's just typically around that kind of figure. So once we've got that, we want the gum line to be pretty much straight. Okay, it's not going to be exactly straight, but pretty much straight. And we want the highest point of the gum to be 1/3 of the width towards the back of the tooth. So I've drawn this front tooth into thirds, and this one here, that's going to be our highest point of the gum. So we call this the gingival zenith, the highest point. Now we've got all these kind of key landmarks. All we do is kind of join the dots. So I'm going to do this for you, and in the video I'll probably speed this bit up so you can see what it looks like. Okay, so we can see now roughly what we want our grand design to be looking like. At this stage, I haven't even talked about what the correct treatment is or how we can get to that point. It's pretty typical that the patient would come in and say, hey, look, I've got this missing tooth and I want veneers. Because it's a pretty common misconception that veneers will fix missing teeth. The truth is, if you've got missing teeth, you need to be looking at implants, veneers, or possibly removable dentures to replace those teeth. And the reason we start with aesthetics first is whatever we do, we want to make it look really good. Anybody can put an implant in and put a tooth on there, and it will look okay. It will fill the gap. But what we're trying to do here is actually create a really beautiful looking smile that looks natural. Now you can see just from this mock-up that I've done here how much a difference it's made to the overall look. And all we've really done is, one, filled that gap. That was probably the most obvious thing. We've added a little bit of length to the front teeth. This one, I've added a little bit of shape to the front, and all we're doing is minor changes in the shape of the teeth to have a dramatic effect in the overall look of the smile. And in a case like this, typically you would probably use a combination of implants and veneers and crowns and all these kind of things. These are all tools to help us get to that amazing smile. But like an architect is going to draw drawings of a house and his vision of how that's going to look like, this is essentially what we're doing at this stage. And there's a lot that goes into this. I mean, I've given you a couple of ideas earlier on in this video, but there's other things like the axial inclination of the teeth. I want it to look like everything's kind of tilting in a little bit. I want this corner of the front tooth to be a little bit sharp. I want this corner to be softer. I want these two corners to follow the same kind of pattern, but on the side tooth they're much softer than they are in the central tooth. So again, it's a lot of little finesse that helps create that perfect end result. And perfect is subjective. You know, perfect for me may not be perfect for the patient who we're treating. So that's the reason we build all of this stuff up in temporary materials first before we go into our finals, so our patients can really test drive what the end result should look like. So let me just delete this. Okay, and if we skim forward, we can see that this is the actual photos, well, the actual drawings that I did for my patient at the consultation. And I'm just going to skip forward. Okay, so here, the one thing we couldn't see before was the gum line. And now we can see the gum line. So the gum line at the front is not bad, we can refine it. We can use soft tissue lasers just to sharpen and define. These little triangles in between, in the middle of the teeth, they're really important. If you can define those, things look really nice. Here the gum is low down, so we would use a soft tissue laser to help lift that gum line and just reshape it so it looks in harmony with all the other teeth. That's really what we're trying to do. Now, sometimes it's difficult because there's a lot of gum recession. The gums have receded up higher. So in those situations, we actually use things like optical illusions and create reflection lines in the teeth to help it look a little bit more normal, because we don't want the height-width ratio to be completely out. But really, the first stage of designing a great smile is envisaging what it should look like. And these, what I've shared with you in this video, are the key principles in order to do this. So if you got something out of this video, please give it a thumbs up, consider subscribing. If you're interested in cosmetic dentistry and you want to learn more, you can put a comment below this video, and I try and respond to all of the comments, and some of them inspire future videos as well. Okay, so guys, until next time, I hope you enjoyed this video. I hope my wallpaper didn't put you off too much, and I will see you again soon. Take care.